I am your Dr. Gabby.
Hi.
Can I get your name and date of birth?
Yes, my name is Emma Champlin and my date of birth is June 30th of 2000.
Thank you.
Mm-hmm.
And so I know you've been having a couple seizures.
Yes, I've had 2 in the past couple years.
Okay. So we have diagnosed you with epilepsy, okay?
Mm-hmm.
This is just abnormal brain waves.
Okay.
So you're having a couple seizures.
Mm-hmm.
So we are going to recommend you with Carbamazepine.
Mm-hmm.
This is just to help prevent seizures. So we did do genetic testing on you to see if you have the HLA-B allele, and you are negative for that. So that's good because it does have an interaction with this drug.
Mm-hmm.
Also, I am going to recommend periodic eye exams and blood work because we want to make sure your red blood cells and your white blood cells are working well with this drug and they're keeping a therapeutic range, okay?
Okay.
That's going to be about monthly, okay? So you have to come
Alright.
in monthly.
Alright, so just make appointments with the front office or something?
Yes.
Okay.
And then, are you pregnant?
No.
Are you planning on getting pregnant?
No.
Are you taking birth control?
No.
Okay. And then, so this drug might make you a little tired or fatigued at the beginning of taking it. So I'm gonna keep you from driving or doing heavy machinery just because we don't want you to have any accidents happen, okay?
Okay.
And then you're taking other drugs?
No, not at the moment. No.
Any herbal supplements?
No.
Okay. There are large drug interactions with this drug.
Mm-hmm.
So if you do take any over-the-counter medication, herbal supplements, or anything, just let us know,
Okay.
and we'll let you know if that's safe to take it with it, okay?
Okay.
And then, do you have any history of bone marrow suppression disease?
No. No.
Liver disease?
No.
Or heart damage?
No.
So talking about our patient, Emma Champlin, she had seizures in the past, so we're going to give her carbamazepine, okay? So I want you to go over with her how she should take the drug, how she should store the drug, any side effects and like potential adverse reactions that might happen with it, and then any food and drug interactions.
Okay, sounds good.
And then answer any questions she may have.
Alrighty, got it. Hi there, my name's Caroline. I'm going to be your nurse for today.
Okay.
And I'm just going to be going over some more medication information about your new prescription, carbamazepine, okay?
Mhm.
So I'm just going to tell you about like how you should take it, some side effects that you may have, and just some things to look out for in case you want to call your doctor again to have any changes. So the first thing I'm going to tell you about is just how you should take this medication. You want to take this as prescribed, make sure you're not taking any less or any more than ordered. Take this medication on a consistent basis, so around the same time every day, and make sure not to stop this medication abruptly because this can cause some rebound seizures or some other extra adverse effects. Also, you can take this with food just so that way you don't have any GI upset or just any stomach pain. One thing to mention though is do not take any grapefruit juice with this, and that can actually increase your medication levels, which isn't the ideal that we want to have for you. Make sure with your medication that you don't chew, break, or crush these tablets as well. Just go ahead and swallow them whole. Just some general storage information. Make sure to keep them in their original container and store them tightly and away from any moisture. Do you have any kind of children or pets at your home?
No, I do not.
You don't? Okay, so that's good. So even so, if you ever have any visitors, make sure that you keep the medication out of reach. And also go ahead and store this at room temperature and protect it from any light.
Okay.
You are going to experience some side effects. You may have some nausea and vomiting, some dizziness and drowsiness. There's also, you may have cases of dry mouth, swollen tongue, constipation may be an issue along with some balance problems. So just keep that in mind while you are taking those meds. You may also have some potential adverse reactions which can be slightly more dangerous, or you want to be a little more cautious about this than your other side effects. So you may have some issues of something called Stevens-Johnson syndrome, which is a kind of potentially dangerous reaction, and this can have some blisters and some rashes on your skin. I'll go into a little bit more on that when we talk about calling your provider in a second. You may also have some respiratory issues, so a little bit of slower breathing. You may experience that. This medication also has a little bit of issues with your liver, so you may have some liver inflammation or some kind of liver injury, so just be cautious of that as well. And do you have any history of depression, anxiety, or bipolar?
No.
No? Okay. So just one thing to mention that this medication does cause some mood or behavior changes. If you have any adverse change or great adverse changes in your behavior, you may also develop some suicidal intentions or thoughts. So please let us know if you have any of those as well, so we can make the correct adjustments.
Okay.
And then one last thing, I'm just going to go over some stuff that you may want to contact your provider about. So you may feel very weak and have fever, shortness of breath, and some unexplained bruising or bleeding. Go ahead and call us and let us know if you are experiencing that, so that way we can take a look at that. If you have any other signs and symptoms such as fever, chills, a very bad sore throat, cough, or a wound that won't heal, let us know about that as well. And then touching again on the Stevens-Johnson syndrome, if you have any red, swollen, blistered, or peeling skin, this can be like anywhere throughout the body, some irritated eyes, or the blisters or sores on your mouth, go ahead and contact us right away, so that way you get that.
Okay.
All right. Do you have any other questions for me?
No, not at the moment. Thank you though.
Yes, of course. So again, just call us if you ever need anything else, and
Okay.
if you have any more questions.
All right, sounds good. Thank you.